Okay, so now we want to treat her frontalis. So I never treat a frontalis in isolation. If you treat the frontalis in isolation and relax the levator muscle, but you leave the depressor muscles active, you're almost certainly going to give a person a brow ptosis. But once I've treated this glabellar complex, as I have in this patient, then I can move on and I can treat her frontalis. I'm looking for the margin, the superior margin of her muscle. So raise up for me. Her muscle activity goes to here, approximately to her hairline. Relax. And I want to be injecting at the 1/3 to 2/3 margin of the forehead. And I have my choice to inject either 4 or 5 injection points. If I'm going to inject 4 injection points, then I'm typically, open your eyes for a minute, I'm going to go mid-pupil, medial canthus, again at the upper 1/3 to 2/3 margin. When you've injected the glabellar complex, you're going to get some diffusion out of the corrugators and the procerus that will smooth the inferior portion of the frontalis. And when you're injecting at the 1/3, 2/3 margin with 1 centimeter diffusion, you're going to get the upper portion of the frontalis, but leave enough strength so that they have eyebrow activity, which is what makes someone look natural. But you can see here, if I go mid-pupil for her, then I ask her to raise up your eyebrows. You can see I've got more activity in the frontalis 1 centimeter lateral to that injection point. Relax. If I would inject it in this fashion, in 2 weeks, this central portion would be smooth and quiet, but this lateral portion would have all sorts of activity, and the patient, first of all, will look odd because they will have creasing in their forehead. Their eyebrow will be a distorted shape, and oftentimes, especially if they have any heaviness on their upper lid, they're going to call you and say, I have a line in my forehead or in my eyelid that I never had before. I have a line in my eyelid that I never had before. And that's a sign basically that they have a spock or a fistula. So to stop that, I'm going to, instead of injecting at mid-pupil, I want to inject at lateral limbus, so where the sclera and the iris meet. Lateral limbus, center, and then I'm going to space my injections evenly in between. If she still came back with a spock and she had all sorts of crinkling up here, I'm going to look for the highest point of movement. Raise up your eyebrows. Okay, so this highest point of movement, I stay 1 finger breadth above the eyebrow. Relax. It's the only time I take an eyebrow as a landmark. And I would give her anywhere from 1/2 to 2 units, depending on the activity she has here. Because the trick is, if she has a spock, you're trying to relax the inferior portion of the frontalis enough without actually dropping the brow. But to start, we're going to give her 5 units into her frontalis. I go really superficial. I line up actually with her lateral limbus with the barrel. I'm just going to tuck underneath and just give her 1 unit. Right, open your eyes for a minute. Relax. I give her 1 unit. I'm going to go in the center. And then I'm going to space the other ones evenly in between. Now, I've treated this patient before. She gets a very slight spock. But now you can see that with this most lateral injection, you get 1 centimeter of diffusion. Raise up. She still has a little bit of activity here, and so I'm actually just going to pop in a little 1/2 unit here. Turn. Raise up for me. And a little, again, 1 finger breadth, a little 1/2 unit here. Relax. And I'm doing this prophylactically on this patient because I've treated her before. If I'd never treated her before, I wouldn't do it because you don't necessarily get that spocking as you might suspect. I treat a frontalis really conservatively. It's oftentimes only 1 or 2 units per site because you can always add in 2 weeks if you need to. But if you over-inject this frontalis or you inject it too inferior, you're going to give her a brow ptosis. And when she has a brow ptosis, it becomes very difficult to treat because you have to wait for the strength of the frontalis to pull the eyebrows up again. So always be really conservative in your frontalis injections.